record. Here, hello everyone, and good morning. Welcome to today's session on navigating ketamine. I am Verna Felipe, ICU DDR coordinator for educational programs and regional support. To know more about our organization, watch previous webinar recordings, and get access to drug demand reduction related resources, we invite you to visit our website at www.icuddr.org. If you are faculty members from higher learning institutions, we also encourage you to sign up for membership. As a gentle reminder, kindly ensure that your microphones are turned off, and for questions, you may use the chat box and our speaker will address them at the end of his presentation. So as a reminder, this webinar is being recorded. Lastly, translations for closed captions for various languages are now available. To turn on this feature, click the CC icon at the bottom on your screen and turn on translation and select the closed caption language of your choice. So our speaker for today is a board-certified physician in pain medicine, psychiatry, addiction, and geriatric psychiatry, and psychosomatic medicine. So Dr. Howard Cohen is an experienced doctor in a wide variety of pain management techniques, and he combines compassionate care with medical expertise to help patients. He is widely regarded as a leader in pain rehabilitation and has won several Best Doctor in Pain Management awards. In addition to treating patients, he is also an assistant professor at the University of Texas at Arlington, and he regularly publishes his research and studies in scholarly journals. Dr. Cohen is a Dallas resident who they had like here in Texas, we had bad weather the last week, but luckily for all of us, we're doing well. So he spent a lot of times outdoor and with his family when he's not working. So ladies and gentlemen, welcome Dr. Howard Cohen, sir.
Thank you. Thank you, Verna, and thank you for ICU DDR. Good day, everyone. This is a subject that's very near and dear to my heart. This is a timely discussion of a very exciting molecule that is very effective for certain psychiatric and pain conditions, but there's also a potential risk of unsanctioned use and addiction, which we will kind of talk about in detail. So we're going to talk about ketamine, where it comes from, what are the positives and negatives about it, and how to recognize when patients or people may be exhibiting signs of unsanctioned use or addiction, and how to be able to understand this. Ketamine was discovered by Calvin Stevens. He was a researcher in Detroit, Michigan, Wayne State, and he was basically trying to alter the molecule PCP. People may have heard of PCP as a drug that has an addictive potential. Frankly, its addictive use was kind of overblown for political reasons. But that being said, it was not an ideal agent for things like pain management or anesthesia, because patients, when they would come out of the PCP when used for anesthesia, would have episodes of dissociation, psychosis, confusion, and it lasted too long, so it was less an ideal agent. So Dr. Stevens was able to modify this compound and make it one that it's been very important and is used with that around the world today. One of the early uses was in the Vietnam War, United States. It was felt to be a much safer agent compared to morphine for battlefield use, which kind of speaks to its overall potential safety. So ketamine was synthesized by Dr. Stevens in 1962. It was studied and eventually within 8 years became approved as an anesthetic. Its mechanism of action was worked out a few years later. And then It was recognized a couple of years after that as an essential medicine around the world. In terms of its use for depression, it was first studied by Dr. Crystal, and it became understood to be useful for depression, and an intranasal version of this, which is insufflated in the nose twice a week or less, was eventually FDA approved in the United States and Europe about 20 years later for treatment of depression. So here you can see the ketamine and the PCP molecule, very similar in structure. So, how did Dr. Charney and Dr. Crystal understand that ketamine may have some potential use? Well, they were initially using it to study models of schizophrenia because it was felt that there may be a ketamine-like molecule floating around in the brain that was responsible for some of the fantastic effects of schizophrenia, including memory problems, hallucinations, learning dysregulation. And so they were looking at this as in terms of a schizophrenia model. And they had this idea from some of the early research, especially in rats, where they did forced swimming tests, that this seemed to be something potentially useful for depression. So they tested it, and lo and behold, they got some positive results around 2000. Prior to that, it had been around worldwide use, initially as an anesthetic because it was so safe. It was part of the mixture of anesthetics that would be administered to people going to sleep for surgery. And it became very useful in acute pain management, most widely in children who seem to tolerate dissociative effects well without fear. And children are given this even today in emergency rooms, for example, when they need to be calmed down and get pain relief to set a broken bone, for example. So you see Dr. Charney on the left, Dr. Crystal right now on the right, who's a very active researcher in the ketamine space at Yale. Ketamine has captured the imagination of pop culture. On the left, you see a popular podcaster who talked about his experience in ketamine. As an example, this fella was initially administered 6 sessions of ketamine for significant depression, and his 20 years of chronic pain in his ribs completely disappeared. So when you get pop culture figures speaking to the utilization of this chemical, it becomes very, people become culturally aware of it, and it spreads the knowledge about this drug. You can see on Time magazine, they put this on the cover. That's a good and a bad. Usually when things are on the cover of Time magazine, it speaks to the time and place of the zeitgeist where things are very popular, and it's reaching popular peak culture. But as we know, when things are kind of promulgated and promoted as being the greatest thing ever, within a couple of years, negative stories seem to come out about it. Ketamine can be administered in various ways. We do it for depression and pain, and for surgical and for emergency room use, for example, by IV. It could be snorted, as we see in a powder. On the left, those little cubes are called troches, which are administered off-label to patients for things like depression and pain control. This has been a little source of controversy in the United States, as there's been internet prescribing of this medication with less than adequate, sometimes, evaluation of the patients, which could potentially lead to unsanctioned use or this product floating around. And we see Spravato, which is a brand name for intranasal ketamine that has been approved just for depression that's to be administered in a physician's office for 2 hours at a time under observation. Ketamine is bioavailable in multiple formats. Intramuscular is also used in psychological therapies for depression and for psychotherapy, intranasal in doctors' offices, and there's other routes of administration. They're not quite as potent as the intravenous forms. So when we figure out how much to give a patient, we will use this type of guideline to try to calculate how much they may need for different indications. Ketamine is a drug that causes dissociation, a separation from reality. So it's very important to have the proper set and setting for this type of drugs. As with all drugs that alter consciousness, especially even classical psychedelics, which are now being investigated for things like trauma therapies, for pain, PTSD, and the like. On the left upper corner, you see our facility where we administer ketamine asleep for pain. We also do it for depression, but it's given for pain in highly monitored conditions, just like where a patient would receive for surgery. On the right top, you see Dr. Mandel. He was a early promoter of ketamine for depression, and it's given in this format awake in the depression model, where it's very important for patients to have privacy and comfort and quiet. They use eye shades, they'll listen to music, and music has been shown therapeutically to actually help the experience of ketamine in terms of probably regulating brain waves. In the bottom right corner, it's a representation of what's called ketamine-assisted psychotherapy. Low doses of ketamine can be used, for example, in trauma therapies. A bit higher doses are used for the more treatment-resistant types of therapies that'll be dealing with things like intractable eating disorders or severe trauma. On the bottom left corner, you'll see raves. Ketamine is one of the club drugs, as there's a couple of them, which has been used. And we've known that not only have drugs and music been combined for purposes of euphoria, relaxation, and group cohesiveness. This has been going on not only in the club scenes around the world, but it's been going on since recorded time in various cultures around the world, where they would administer drugs that would alter consciousness, combining with drum beats and chanting, things of that nature, in order for people to be able to potentially utilize cohesiveness as a group, transformation, and for healing states. The dose of ketamine is very important in terms of what kind of effects that you may see. The lower doses are used predominantly for analgesia, as an example, again, in the emergency room. The middle dose is 0.2 to 0.5 milligram per kilogram. Those are the recreational or party doses, which people would generally use in terms of that type of setting. But it's important to recognize when people are utilizing the substance, they may not know what type of dose they're actually getting, and they may get past that 2 milligram per kilogram threshold, where they become fully dissociated, and even farther down, where they separate completely from their body, and that's known as the K-hole. Okay, we'll take a look at this little video.
I came to see Dr. Cohen 6 years ago after a very painful hysterectomy that left me unable to walk for 8 months. I had pain, anxiety, depression, a lot of PTSD, and Dr. Cohen helped me with medications and talk therapy. And as I was getting better, things were improving in my life. And then a tornado hit, and it destroyed our home and left my bones shattered and broken from falling bricks and debris. So Dr. Cohen started ketamine treatments that helped me through all of the pain, the anxiety, the post-traumatic stress disorder, the depression, everything that I was going through, and I'm feeling so much better. It's a tool that enables you to get your life back.
Patients typically receive a series of IV infusions over a course of 2 to 3 weeks, followed by boosters when necessary. Treatments are typically 1 to 2 hours and may be administered while awake or asleep under IV anesthesia. Some patients require longer or more frequent infusions depending on their individualized treatment plans. Many patients also benefit from pain blocks performed while asleep, causing no pain but leaving lasting pain relief. Treatments are typically very well tolerated, and they are often treatments.
So this is an example of a woman who was able to benefit from ketamine from a lot of the indications that we see that make it such a powerful potential healing drug. She had neuropathic pain from a traumatic amputation. It helped that. She was able to utilize it for depression. She was able to utilize it for anxiety, for post-traumatic stress disorder. So this shows how powerful this drug can be. The ketamine is known to reboot a person's nervous system in terms of their physicality, in terms of their what's called default mode network, which is their automatic thinking. It's utilized for the treatment medically for depression, for bipolar disorders, for various types of eating disorders, many of which are related to trauma. Post-traumatic stress disorder is a particularly difficult to treat malady that ketamine can help with in terms of not only new learning, but amelioration of the trauma symptoms in terms of the chemical nature of them, as well as utilizing it with ketamine-assisted psychotherapy, where patients were able to go back to the trauma and dissociate it from the nervous system. Various anxiety disorders and obsessive compulsive disorders respond very well to ketamine. Sometimes it'll be added on to a pharmacologic regimen that's not working. Sometimes it can potentially be used as a sole agent. And of course, some patients will have combined disorders, will have chronic headaches or nerve pain or central pain syndromes. So if you administer the ketamine in a proper dose range, you can get the dual analgesic qualities and the improvements in things like emotional disorders, as well as comorbid chemical dependency conditions. So even though ketamine itself is a drug that is potentially liable to abuse, we know that one ketamine treatment combined with psychotherapy can reduce alcohol use in alcohol-dependent patient relapse after 6 months from approximately 85% to 15 to 20%, which is remarkable with one treatment. It's also used for opiate dependence. It has a quality which such it's able to reduce actual physical withdrawal symptoms as patients become less sensitive to the physically dependent effects of opiates. So they'd really become less likely to be dependent because they're not psychologically near as addicted to it, and physically as well. And so it's useful to treat a patient who has combined pain issues with chemical dependency issues with opiates, or just to dramatically reduce opiate use because the craving disappears and the physical symptoms of withdrawal can disappear as well. And interestingly, as ultimately all these types of substances that may cause chemical dependency may be linked to dopamine in the brain. Stimulants such as cocaine, for example, and other stimulants can be dramatically reduced in terms of craving with ketamine as well. And we're seeing more and more thinking in terms of medication-assisted psychotherapy, medication-assisted treatment for chemical dependency, not only with this molecule ketamine, but things like buprenorphine for opiates or other things for stimulants. So there was a thought at one point that you shouldn't administer any type of potentially addictive, dangerous drug to patients with chemical dependency issues. But we find now, given in the proper way, it actually can improve outcomes. Ketamine-assisted psychotherapy is a special type of therapy where the patient will be administered ketamine literally while they're doing the therapy. Although there are models where the ketamine could be administered and they could still benefit more dramatically to therapy even up to 5 days later. So for this type of model, the patient has to be in a good headspace when they come into it. They have to be prepared for it, have a proper dosing strategy, and then the material that comes up in their consciousness, which may be thoughts and feelings that have been repressed or suppressed from many years ago. Brain opens up with ketamine and it remembers lots of things that have been pushed outside of awareness. And that allows, when one is working with a therapist, to be able to have access to this material and integrate it into an adult's way of looking at the world, for example. Eye movement, desensitization, reprocessing therapy is a type of therapy which is a combination of hypnosis and cognitive behavioral therapy that is used for post-traumatic stress disorder, where the eyes will be targeted for movement to dissociate the physical symptoms from the emotional symptoms of the brain. And that's often synergized with ketamine. There's different ways to be able to administer this type of therapy through different types of delivery systems, be it oral or sublingual or IV. And there are some cases where very high doses have been used for multiple hours for the more intractable types of conditions. Ketamine is very useful for chronic pain. We see chronic regional pain syndrome, which is a neuroinflammatory disorder, which is thought to be one of the most painful maladies known. Ketamine has an excellent record of erasing this completely in some patients, and we really don't have any other effective therapies. We use implants and combine with physical therapies, but the ketamine can cause a reboot of a person's nervous system and improve this significantly. Ehlers-Danlos or syndromes of connective tissue disease, which there's hypermobility, but high central nervous system sensitivity is also combined with comorbidities such as attentional problems and obsessive compulsive disorder, bipolar disorders. This responds very nicely to ketamine, as this central sensitization syndrome. And central sensitization is a process of nervous system being highly sensitive. It's thought to have neuroinflammatory causes, and this affects every system in the body in terms of amplification. So in terms of the bowel, it could be irritable bowel syndrome, it could be a chronic daily headache, it could be leg movements, it could be cramps, it could be chronic fatigue, it could be what's called fibromyalgia, hypersensitization of a person's body. These things are all potentially are able to be rebooted through administration of ketamine. So how does this work? So to get technical, ketamine blocks pathway of GABA, and GABA is a calming mechanism, and GABA drugs that increase GABA are potentially things like benzodiazepines and alcohol. This interferes with this braking system that surges like Morse code, leading to this pulses of glutamate, which changes identification signals in the nervous system. This increases the system involved in terms of growing new brain connections, which is BDNF, and mTOR, which is basically causing changes in the metabolism. This causes new growth in terms of brain connections and more dendrites. So just like a child, when their brain is very neuroplastic, they can learn lots of new things and they have tremendous and rapid growth. This molecule can simulate a change as to a person is almost reborn in terms of the nervous system. So this causes changing a person's thinking, ability to adapt, and we know that through psychotherapies and positive intention, these things can be reinforced. We'll see the ketamine actually growing new brain connections on the bottom compared to the top. So these things have been well understood and studied so far. As well, you'll see here a representation through functional MRI and computer modeling a default mode network. Default mode network is a nervous system's autopilot system. And so this is what you're thinking about when you're resting, when you're relaxing. And many times when people have depression, they'll have negative thoughts in terms of autopilot. And with the ketamine, it can cause increased connectivity with the parts of your brain responsible for processing and thinking, so distorted thoughts can be improved. And we know that the ketamine will cause changes in brain waves that are similar to what's happening in mystic states when people will spend thousands of hours in terms of meditation to be able to change their brain waves and to get into a state of high receptivity and learning. Ketamine can do this very quickly with similar results. Now, ketamine also has to be respected in terms of its potential for abuse. We'll see on the left a kit that's used for raves to be able to test different drugs to see what it is. People are taking these drugs, they don't really know what it is, and much of the danger of people going to raves and using drugs off the street is they're getting things they don't really think it is. Ketamine itself is relatively safe, but party goers and rave goers may be given all types of other things that could be potentially dangerous. So now in certain areas, in terms of harm reduction, these things are being tested, but it is recreational use at raves. And why do people want to use ketamine on the street? Well, there is the psychological effects of euphoria and dissociation, which means a person's consciousness in high enough doses seems to leave the body. Well, that could be potentially dangerous. A person could fall or get injured when their brain, so to speak, and all their view of the world is separated and they feel like they're floating around the universe all by themselves. This can get to a point where if they have enough ketamine, they can be immobile, almost frozen, and they're feeling they're floating. And it could be a potentially dangerous state where people could feel like they die. And that is what's one of the biggest problems when people reach a state called the K-hole. They become panicked that they're dead, even though they may have been cautioned and warned that they may get to the state. When you're in it, apparently, many people will think they're dead. If people use enough ketamine, it can cause various issues. Really, on a chronic use, there have been reported cases of psychosis of people mostly injecting it multiple times a day on a daily basis. And it can be difficult on your heart because it'll increase your blood pressure, increase your pulse. So people that have pre-existing issues with cardiovascular disease and atherosclerosis or pre-existing arrhythmias, they're really the ones that are at risk of having frightening heart damage with ketamine. Ketamine really has moved from Europe, where it was initially used in unsanctioned use, places like Eastern Europe and rural England. So it moves to the United States, big cities like New York and LA, and it's moved mostly to areas now like Southeast Asia and China. And it's used around the world, but so the biggest centers now, I think, would be places like China more than India and parts of Europe and Eastern Europe. But it's moved across the world like all kind of drugs. But ketamine is generally not an equal opportunity drug in that it is more abused by certain types of people. Majority of people will be using this by insufflation, snorting it, for example, at raves, dance parties, and majority of those people will be young men. It's in terms of the population, for example, in the United States, unsanctioned use is still relatively very small and mostly used in recreational dance settings, but it is starting to become more prevalent as it is being used therapeutically and with patients potentially getting take-home doses or people stealing it from veterinarians, which is widely used as a veterinary anesthetic because it's so safe. It's starting to become more prevalent in the United States in terms of abuse. Ketamine is a relatively safe drug. You'll see on this graphic here as the on the axis on the left, the higher you go, the more dependence you'll see. And as we move an axis on the right, the more it goes to the right, the more potentially dangerous it is. So we see top right corner, classically heroin, lots of dependence, lots of danger. We look at ketamine, it's less dangerous than morphine, mescaline, things like that. And it's really less addictive than caffeine. So it's a bit more dangerous than caffeine in terms of potentially having cardiac effects at the high dosage, but it's relatively safe in terms of it actually killing a person in terms of overdose. But as with anything, there have been case reports of deaths with ketamine, but ketamine deaths are generally in young men injecting at home, utilizing other drugs, potentially things like benzodiazepines or opiates and alcohol, and mostly in dangerous settings. So it's not that they die from the ketamine in terms of stopping breathing or having a heart attack, but they will lose consciousness, for example, and slip into the water. There was a case in the United States where a famous former TV actor who was actually had been getting ketamine for depression at one point, was using ketamine at home and died in his hot tub of with multiple drugs. And this on the left, there's a representation of a book by a author named Turner, and he famously died from ketamine again while in his bathtub. So it's interesting. I made this slide of a person dying in the bathtub from ketamine, and this actor ended up dying 2 weeks later. So this is basically how a person dies from ketamine, by doing something dangerous, falling down the stairs, forgetting to wake up, drowning. Ketamine has certain dangers to it. In the short term, like we talked about, it can cause panic, anxiety, feelings of unreality, psychosis, feelings of death, increase your body temperature, especially when dancing, could cause nausea, vomiting, headaches, falling down. Longer term, when people become dependent upon ketamine, it could cause psychotic situations where people lose touch with reality and have delusions mostly and have problems with memory and attention. Physical problems are what we see probably more commonly, especially in places like Asia and rural England, where people will get what's called ketamine bladder. There's a pattern where people will abuse ketamine over the weekends, and they will inject tremendous amounts, maybe 500 times what would be considered a therapeutic dose, and it will cause the bladder to shrink, become painful, irritated. It can move up into the kidneys, and they'll stop urinating. They'll recover after a couple of days, and then they'll go back and use it again on the weekends. So this is the big thing we worry about in terms of medical use, although there's only been one case report that we know of a person who started to develop a ketamine-related bladder problem in medical use. But we do watch for it when we give it therapeutically. We think about 0.5% of patients may start developing some urinary symptoms. But in terms of drug abuse, this is the huge problem where people have extremely painful urination, stop urinating, and it can permanently shrink their bladder and cause lifetime problems. As well, although this is more rare, ketamine can cause irritation of the liver, which we watch out for that. Ketamine addiction symptoms, signs are really more in terms of what the side effects of ketamine are themselves, in terms of people craving the ketamine, having bladder issues, and having memory problems. One thing that's important to understand is psychological dependence of ketamine is greater than physical dependence. So people that'll abuse ketamine will become psychologically addicted to it and crave it. And at some point, even though it stops, they stop developing euphoria from it and they don't like it anymore. They just can't stop taking it. They're like a rat hitting a bar, where this is a much bigger problem actually than the physical dependence symptoms, but there's really not any physical dependence symptoms to speak of. When people stop at cold turkey, they don't really go into a typical withdrawal state like you'll see with opiates. It's really a psychological phenomenon, which is just as bad. John Lilly is a cautionary tale about ketamine. This was a US-based psychiatrist and scientist. He did a lot of work with the military, and his early research was in trying to train dolphins to help divers for the US Navy. He was trying to understand how dolphins communicate. He also was the first person to develop isolation chamber, which people would go into without sight. I mean, it would be completely dark, without any sound. They float in Epsom salts, and they would spontaneously hallucinate after a period of time of complete isolation. So Dr. Lilly wanted to be able to see if he could be able to communicate with dolphins. So he was based in Hawaii at the time, and he built a situation where he had tanks literally in his home where dolphins would swim around, and he would be immersed adjacent in a isolation tank, and he was trying to see if he could communicate with dolphins. Well, he started his journey initially with this model, and he had chronic migraines. He tried everything in the world, nothing helped his migraines, and a physician told him ketamine might be useful for migraines. So he did the ketamine, he injected himself, and lo and behold, his 10 years of migraines disappeared completely. He realized it had interesting psychological effects, so he started using the ketamine, and he would inject it multiple times a day while he was in this isolation tank trying to communicate with the dolphins. Well, eventually, he got to the point where he became psychotic, and he believed that there was a what was called a coincidence control office that on another planet that would communicate and set the agenda for the universe. So he became clearly psychotic, and he was able to talk about this when he stopped using ketamine and was able to reflect on his experiences. And he wrote several books about this, but this is a cautionary tale of a person who used ketamine initially for medicinal uses, but through experimentation became psychotic with it. This is one of the best books I've seen if people are interested in not only the potential for abuse of ketamine, but how it works in a therapeutic basis. And so there's many out there, but I think this one, if you're going to read one book, I think this is one that's widely available on Amazon and other places that has multiple authors and talks about the exciting things in ketamine, but also the potential downfalls of ketamine as well. So thanks for listening to my presentation. As you can tell, I'm very interested and passionate about this. It's a fascinating molecule that has done a lot of people good. And it's been life-changing for many people in terms of therapy, but also has significant risks in terms of addiction and unsanctioned use. So we'll open up to the floor for questions if anybody has any.
Yes, Dr. Cohen, thank you very much for an excellent and comprehensive presentation. So we know about the history, the trade, the development, the advantages and disadvantages. And the questions here, I think, is more of an elaboration to what you have shared. So let me read the first one. The question is about how do you help people who have dependency issues in ketamine, and how do you treat their urinary related issues?
Okay. We help people that have dependency issues with, the general model for chemical dependency. We try to get them to restrict their access using friends, family, and educational means. There's no specific pharmacologic treatment. We use the model in terms of things like cognitive behavioral therapies, group experience. We try to do motivational interviews with them to try to take them to look at what are the benefits and the downfalls of it that can be utilized. They can be mixing with the general population, because there's not a lot of people out there that abuse ketamine enough in most places where you can have a separate center, but we use it in terms of intensive outpatient treatments. A inpatient treatment is only useful to keep them away from the ketamine for a short period of time, but they don't really have physical withdrawal from it. Mostly you have to keep them away from it. And then what scares most people with terms of ketamine is the people that are to the point where they're addicted to it, generally the point where they have these bladder problems. And there's no specific treatment for it. We can use certain types of anesthetics that will bathe the the bladder in substances that'll reduce irritation. That's one of the ways to approach it. So there are simple sugars that utilize that. Things like Botox can be helpful for it. The main thing is if you keep people away from it long enough, to some degree, the bladder will get better. There is a tiny percentage of cases where the bladder is totally destroyed and totally ruined. In those cases, unfortunately, a person may have to have their bladder extracted and have a urostomy. That's extremely rare. Most of the people that really developing these problems, they're seeking the attention of medical professionals, very commonly, like I said, in Asian and rural England, where they get so frightened, they're past the point of no control. And if you isolate them away from the ketamine for a short period of time, they lose their psychological craving, and generally their fear takes over and they quit using because of the bladder. The problem with this is they do well with this, and then it's possible for them to return to it many years later. What's interesting about this is patients have a condition called irritable bowel, or rather called interstitial cystitis, where they have a chronically irritated and painful bladder, and ketamine will actually help this condition by resetting the central nervous system. So that is not a potential, the fear of a bladder issue under medical control is not a contraindication using it therapeutically for bladder pain. But that being said, when a bladder is shrunken, it's possible to, again, insufflate it and blow the bladder up like a balloon and try to increase its, ability to reduce the shrinkage. But it's a very, very difficult problem.
So I think, sir, you also mentioned in your presentation that mostly people who actually experiment with ketamine or use it without medical supervision, they're the ones that experience this negative side effects.
Yes, it really has not been shown in the medical setting because, for example, in a medical setting, people may use 35 milligrams IV for depression in terms of a cycle, which they'll cycle maybe twice a week for a month, once a week for a month, 2 weeks later, then stop. In England National Health Service, they will generally do it 3 times 10 days apart, and then switch to a ketamine melt in the mouth troche for depression. So it's used in very modest doses under supervision, as opposed to addiction use. Instead of using 35 milligrams, they'll use 7,000, 10,000, 12,000 milligrams, injecting it usually on weekends, but maybe daily. So it's 500, 1,000 times more, maybe. So again, this is something that we have to be careful about and watch for, but we're really not seeing it in the medical population at this point.
There's another question about the risk of overdose. So is there a risk of overdose for ketamine?
Well, the risk of overdose is psychological, not physiological, because the ketamine, although if a person has a very bad heart and they're prone to arrhythmia or high blood pressure, ketamine can temporarily increase your pulse and blood pressure. But there's really not a risk of dying from having respiratory depression or having a heart attack. The really risk of ketamine is the danger of doing it in a dangerous place, like being in a bathtub or in a body of water and then losing consciousness and drowning, or doing it in a stairway and falling down the stairs, or doing it while a person is attempting to drive or something like that. So it's the danger of the surroundings that really is a scenario, because when a person does enough ketamine, they'll fall to the ground, they'll dissociate, lose consciousness, they'll be in their own world, they're floating in the universe, and they could potentially injure themselves or they could be assaulted. So the only times people die of overdosing ketamine is generally with multiple other drugs, benzodiazepines, opiates, for example, alcohol in a dangerous place. So just using ketamine itself, while temporarily dangerous, would not be thought in a safe setting. So in other words, if a person is sitting in a bed at home, they can use ketamine. They may lose consciousness, but they're not going to literally drop dead. That explains it.
That explains it very well, sir. So it's not really the drug, but actually like the danger it poses depending on where you are, like the setting where you take it. Yeah. There's you mentioned a little bit about the colorful history of ketamine, and so in a lot of ways, people are not very much aware of the benefits of ketamine. So would you like to sort of just run down? I know you have mentioned this, but what are the most common benefits that we get to see with regards to existing
The
clinical
most
trials?
common benefit. Yes, the most common benefits are for things like treatment-resistant depression, patients that have tried multiple types of psychotherapies and a dozen antidepressants that may not have benefited. Probably the majority of these people will benefit from ketamine for depression. First, ketamine may last for 3 days, then for a week, and then for a couple of weeks, then monthly, then potentially forever. There is a subpopulation of patients who get ketamine for depression, however, that the effects may wane after a month, let's say. So in these situations, we'll try to put them on a ketamine-like antidepressant to maintain antidepressant effect, or use a ketamine-like drug, or sometimes they will be on a cycle where if the symptoms relapse, it could be days, weeks, months, or years later, they'll run through another series of ketamine sessions. And like most antidepressants, not only does it help with depression itself, but many of the comorbidities, intractable obsessive compulsive disorder, stimulant addiction, for example, alcohol, all these other types of things. So it's great for chemical dependency. It's good for depression. It's good for anxiety disorders. It's good for PTSD. In the United States, for example, ketamine has a place for intractable post-traumatic stress disorder, which a patient may only have 3 sessions where they'll have introductory sessions. They'll talk with a therapist, get to know them, get to know their issues. They'll do maybe 2 sessions under ketamine where they'll be able to have access to material that's been pushed outside of their awareness in terms of, let's say, childhood traumas or battlefield traumas. And then therapists will use that material to help integrate them. And they won't necessarily have to have any more ketamine for therapy. There's another model less widely used for people that have long-term issues that may use ketamine under supervision, usually by injection, for an extended period of psychotherapy that may last, 10 to 12 sessions. It's known to improve the benefits of not only uncovering therapies, but things like cognitive behavioral therapies as well, because ketamine, not only does it engender optimism, but it engenders new learning. And so people when they have therapy, they hear lots of things, they listen to what the therapist has told them, they work on these issues, but sometimes it doesn't connect. It goes in one ear and out the other. They don't make the required changes. But sometimes when on ketamine, the patient will listen to things that they've understood or heard. It'll actually connect with them, and they'll say, you know what, that's actually a good idea. Maybe I can make that change. So sometimes it fosters dramatic changes in a patient, in a way the person will see the world or the world to think about things. And so it can be kind of a useful adjunct to synergize with psychotherapy. So therapeutic use is one of the main uses. The other main uses in terms of pain control, there are conditions where patients will have pain from central nervous system disorders, chronic widespread pain, fibromyalgia, vaccine-related injuries, chronic fatigue, irritable bowel syndrome, things of that nature, as well as chronic nerve pain, either neuroinflammation which spreads throughout their body or single nerves that are irritated. And it's very difficult for us to treat those kind of things. We don't have a lot of good tools, and the medicines that we use may help about half the people to a moderate degree, but the ketamine, if I had to say, is the most effective agent for nerve pain. Even with all the potential negatives with it, it's the most effective agent for nerve pain in treatment-resistant patients. So we kind of keep those things, close to our awareness when we're trying to treat these patients, because many patients will have intractable pain. They also have comorbid depression or chemical dependency. So utilizing ketamine for some of these patients, if done in a safe way, you can help multiple intertwining conditions at the same time.
Okay, thank you for that. And I guess we're down to our last 2 questions. Can you elaborate more on what do you mean when you say that ketamine is a safe drug?
Well, safe is relative. So It's very safe in terms of, medical administration, where, for example, opiates, for example, can cause overdose and death by reducing respiratory drive. So it's potentially unsafe both at home or, in a clinical setting. So ketamine doesn't cause that, for example. And it's widely used in things like surgeries because it doesn't drop your blood pressure. It doesn't have severe cardiac effects. So it's safe in a clinical setting. In terms of chemical dependency issues, it's safer in terms of the physical aspects. It is something that clearly patients can develop psychological addiction to, and they can develop long-term effects in terms of the percentage of people that have bladder damage. But it's safe in terms of having a heart attack, quit breathing, an actual overdose, which can lead to death. So it's safe in that respects. And again, it is psychologically addictive more than physically addictive, so it doesn't drive that kind of use to need more and more and more and higher doses to the point where you take a high enough a dose where we overdose and kill you, such as with opiates like heroin. So it's all relative.
And sir, the last one is not a question but a request. You showed us the slide about the relatively safe drug wherein ketamine is less addictive than nicotine, than caffeine and everything. There's a request if we can get the resources for further reading, maybe the journal or the book where the table or where the graph came from.
Sure. I can
Oh.
provide that to you and you can disseminate it.
Yes, sir. That would be something that we can do. So, I guess that's the end of our presentation for today. ICUDDR would like to thank you, Dr. Cohen, for sharing your expertise with us, your time and resources. We know that you're very busy and we're very honored to have you here. Thank you everyone for attending our webinar, and we are inviting you to our last session on the psychopharmacology series, which will be on July 15th on synthetic cannabinoids. And to know more about our upcoming events, please follow us on social media. Again, Dr. Cohen, thank you so much, and have a good day, everyone. To the rest of you, have a good evening. For the rest of us, have a great rest of your day. Goodbye.
All right. Thank you.
Thank you, sir.
Bye.
Thank you.